Class, and welcome to our week 2 discussion, where this week we're diving into health insurance plans, right? We have our HMOs, our PPOs, as well as our HDHPs, a bunch of acronyms. So let's take a look at each one of these. So first we have that HMO, which is the Health Maintenance Organization. And here you have patients typically are required to select PCP or that primary care physician. Now, you may also hear this physician referred to as the gatekeeper. We say gatekeeper because the gatekeeper of services, right? Any specialist that may need to be seen or referrals, they would have to see their PCP first for that. Also, with the HMOs, we have lower premiums and lower co-payments. Now, because we have that controlled system where patients are seeing those in-network physicians, they can offer them the lower premiums and lower payments. So you'll find patients selecting the HMOs often. Look at the PPO, Preferred Provider Organization. Now we're starting to look at in-network and out-of-network. So physicians, or should I say patients, have the option to see physicians both. Now, with an out-of-network, of course, higher costs, but they do have that flexibility option. No referrals are needed for those specialty services. Now look at the HDHP, that high deductible health plan. Now, with this particular plan, you may be required to pay certain deductibles, and you may notice higher deductibles with that. Now, those deductibles would need to be paid before most services would be covered. So that's an important element when you're looking at the HDHP plans. You may also find these plans paired with the HSAs, or those health savings account, where you can set money aside to pay for future healthcare costs. Now, similar to our PPO, that HDHP also have those higher out-of-pocket expenses. Now, when we start to look at all of these as a whole, it's important because when we start to document services, bill for services, and understand patients' coverage, determination, right? If referrals or authorizations are needed, if we know which type of plan we're working with, we know what elements are need to be met or standards there. Any questions? I'm here. I'll see you in week 3.